DSM-5 symptoms of developmental coordination disorder. Development and execution of coordinated motor skills is substantially below that expected for a patient's age and opportunities for learning. Clumsiness and slow, inaccurate performance of motor skills are present and interfere with activities of daily life. They impact academic, occupational, recreational, or social activities. Symptoms must begin in the early developmental period, which is around the ages of 3 to 8 years old. They should not be better explained by intellectual disability or neurological condition affecting movement. The criterion A for the DSM-5 disorders is impaired condition and is manifested differently at different ages, which includes delayed motor milestones in some very young children, delay in acquiring or slowness and inaccuracy in performing skills such as climbing stairs or buttoning, slowness or inaccuracy in typing or handwriting or athletic pursuits in adolescence and adulthood. Criterion B for the DSM-5 requirements is impairment of motor skills that interfere with daily activities and is necessary for diagnosis. Prevalence data. Developmental coordination disorder is most evident during the grade school years, which is elementary through high school. Boys are thought to be more affected than girls. Estimates range from 2 to 1 to 5 to 1 depending on the study. There's increased risk in lower socioeconomic backgrounds. 4 to 5% of mainstream primary school children are affected. 6% of children ages 5 to 11 years are affected. There's also no difference across ethnicities. Biological theories attribute the disorder to prenatal complications, which include fetal malnutrition, low birth weight, or prematurity. By definition, children with DCD have no identifiable medical or neurological condition that explains their problem. Risk factors. Exposure to alcohol and drugs in utero increases the risk of developing DCD. Premature birth also increases the risk. The more premature the baby, the greater potential disturbance of neuronal migration and connections, which can lead to difficulties with attention, self-control, and self-inhibition. Treatment options. There are several different types of treatments for DCD. Cognitive motor therapy attempts to teach movement patterns to children who have difficulty with certain tasks. It's planning a motor movement, executing it, and evaluating the results. Sensory integration therapy attempts to teach children who are sensitive to stimuli how to cope while carrying out motor activities. Children insensitive to stimuli are subjected to gradually increasing stimulation, which is called shaping. Kinesthetic therapy seeks to increase awareness of motion in space, which will lead to better control of motor function. Bobath's neurodevelopmental approach seeks to facilitate the appearance of age-appropriate reflexes and normal sequence of muscle activation. Assistive technology is becoming increasingly helpful in making it easier for patients to use appliances and to communicate effectively. It includes using keyboards to type instead of handwriting, mouse alternatives such as joystick and trackball, and alternatives to pencils include computers, portable note takers, and cameras to take notes. Prognosis. There is no cure for DCD, but with early intervention and treatment, it can reduce emotional, physical, and social consequences of the disorder. Without treatment or therapy, children tend to have symptoms that persist through adolescence into adulthood. However, with proper training and education and motor skills, it can help lead to a normal and fulfilling life. Multiple follow-up studies of children with this disorder show that children do not outgrow their motor difficulties. There are multiple disorders that are in conjunction with DCD, such as speech and language disorder, specific learning disorder, problems with attention such as ADHD, autism spectrum disorder, and disruptive and emotional behavioral problems. Children with DCD may develop poor self-esteem and withdrawal from activities or develop a feeling of being indifferent. Children who did not receive therapy or treatment often show poor social functioning and compromised emotional development. With treatment, children can learn and execute motor skills more accurately. They can learn and execute actions faster than those without treatment. The end.